Hi everyone, welcome back to my channel. In today's video, we're going to go over NCLEX and NCAS CBA prep review questions. So let's get started. So the first question we have here is acute care. A patient with acute chest pain is in the emergency department. Which intervention should the nurse prioritize? This is something I used to do with my students preparing for NCLEX, CPNRE, and their NCAS CBA and SLA even, is to read the questions carefully and then pick out the keyword or the key phrase. So you can pause the video here and I just want you to look at the question and then pick out which is the keyword here. Okay, now you have your answer. So now let's look at your choices. So you have administer morphine for pain relief, place the patient in a supine position, administer oxygen via nasal cannula, and perform a 12-lead ECG. So now look at your notes. If you wrote some notes, you can tell me what is the keyword here. And if you chose prioritize as your keyword, then perfect, you have the right answer. So prioritize is the keyword here, and what the question is asking you is, as a nurse, what should you do first? Right? So now let's go over your choices. So administer morphine for pain relief. Although morphine is perfect in terms of pain relief, it can relieve the pain of your patient who is having acute chest pain. That is not your main priority. That is not your first step in terms of intervention. So yes, it's correct, but it's not the right one. So cross. Next, place the patient in a supine position. So what do we know in terms of patients having chest pain, right? So patient is having chest pain, there is a possibility that the patient is having difficulty breathing as well. And if we're putting a patient in a supine position, that is not the best position for your patient. Your patient will just have more difficulty breathing. So letter B, X. Next one, administer oxygen via nasal cannula. That sounds kinda right. Letter D, perform a 12-lead ECG. And that sounds right as well. So when we're looking at these answers, if I'm the student, I would choose between C or D. However, looking back at the question, it's asking you for the priority. Priority meaning, what should you do first in terms of emergency? So when you're looking at this question, the patient is having acute chest pain. It doesn't really specify that the patient is having difficulty breathing or the patient is having shortness of breath. So in this question, in this situation, performing a 12-lead ECG is the priority in terms of your nursing actions because this will address the acute chest pain. This will address the life-threatening condition first. We need to figure out what's wrong with the patient. So performing an ECG would be the correct answer. And then if a patient is having difficulty breathing, right, then you can administer oxygen via nasal cannula for comfort. So you can even give like 1 to 2 liters, right? So letter C is correct as well, but that is not the priority. All right. Okay, now let's go to the next question. Now you have a maternity question. A postpartum patient reports feeling dizzy and lightheaded. The nurse observes heavy lochia and a boggy uterus. What should the nurse do first? So again, pause the video, pick your answer, pick your keyword, and then start the video again. Okay, now that you have your answer, now let's look at the question. So the key phrase here would be do first, right? What should the nurse do first? So what is it asking you is, again, what's your first nursing intervention, right? So looking at the question, the patient is having heavy lochia and a boggy uterus. So what do we know about maternity in terms of post-op? Right? Postpartum. Heavy lochia and a boggy uterus means postpartum bleeding, right? Postpartum hemorrhage. So that is an emergency. So performing a fundal massage, increase IV fluid rate, notify the healthcare provider, or check the patient's vital sign. Priority intervention here would be to perform the fundal massage, right? Because that will encourage uterine contraction and also that will reduce bleeding. Increasing IV fluid rate, notifying the doctor, and checking the patient vital signs, those are all correct interventions as well. However, the question is asking you what is your first step that you're going to do. After you do the fundal massage, right, to reduce the bleeding and to encourage the uterine contractions, then that's when you can do letter B, letter C, and letter D as well. Right? So checking the vital signs, it's important, but it doesn't necessarily stop the bleeding. Same thing with increasing IV fluid and notifying the doctor. So that will come after performing the fundal massage. So when you are looking at this question, the question is asking what should the nurse do first, right? That's the keyword, do first. Always address the root cause first, the root issue of the problem, especially in emergency and urgent scenarios. So, a med search question. A nurse is caring for a patient with COPD who is receiving oxygen at 4 liters per minute via nasal cannula. The patient becomes drowsy and has a decreased respiratory rate. What is the nurse's best action? Increase the oxygen flow rate, call the rapid response team, lower the oxygen flow rate, or administer a prescribed bronchodilator. Okay, so again, pick the keyword and pick your answer. Now that you have your answer, now let's pick the keyword. So let's look at the question again. So you have all your information in terms of your patient. Now let's look at the last section, the last line of the question. What is the nurse's best action? So what this question is asking you is best action. So that means A, B, C, D can all be correct. However, it's asking you for the best answer. So just looking at this question, some key information that you need to know prior to doing this question, that's why you need to review ahead of time, is you have to know about COPD patients. So what do we know about COPD patient? With COPD patients, we can't give oxygen just like that, because with COPD patient, they rely on low oxygen levels, right, to stimulate their breathing. Basically, the low oxygen levels in their body signals, right, signals the respiratory system of how to stimulate, how to regulate their breathing. Okay, so increasing the oxygen flow rate in this scenario will worsen the patient's hypoventilation. So it'll just exacerbate what's happening with the patient with COPD. Calling the rapid response team, that is correct. However, that's not the best answer, right? That's not the best answer here. You can't just call rapid response team and not do anything because you don't even know when are they coming. Letter C, lowering the oxygen flow rate. And then letter D, administer a prescribed bronchodilator. So if I'm the student, I would choose between letter C and letter D. However, it's only asking you for one answer. So what is the best answer? So the correct answer here would be lowering the oxygen flow rate, right? So lowering the oxygen flow rate in this scenario will help the patient restore the patient's drive to breathe. Just like I mentioned earlier with COPD patient, if they have lower O2 levels, it'll stimulate their breathing, it'll regulate their breathing. So we need to lower that oxygen flow rate to help with the patient's hypoventilation. Then next, we can administer a bronchodilator, right, after you have fixed the oxygen level. So in this scenario, you do need to know some pathophysiology ahead of time. So for COPD, it's good to understand how oxygen therapy can affect the respiratory drive in this scenario. Okay, next question is mental health. So you have a patient with schizophrenia, and the patient is telling the nurse, I hear voices telling me to hurt myself. Now, the question is, what is the nurse's priority action? And again, the first thing you need to do when you're reading this question is pick out the keyword and then look at your choices and choosing what would be your priority action, right? So the keyword here is priority action. So when it's asking you for priority action, that means what's the first thing that you need to do right now? What should you do first in terms of interventions? So with mental health, the key priority, okay, always safety concern, always addressing and assessing for safety. So Just looking at the choices, ask the patient about their plan for self-harm, offering the patient a distraction to focus on, notify the healthcare provider, or provide reassurance that the voices aren't real. So, looking at the choices and just what I said in terms of safety, the correct answer here would be letter A. Ask the patient about their plan for self-harm, because that means you are going to be assessing the patient's intent of actions, right? You're going to be assessing their level of intent. And also that will help guide your interventions, your plan of action, right? It'll give you critical information to guide your care. So letter A is the correct answer because that will address the issue of safety. Letter B, offered the patient a distraction to focus on. That is correct as well, right? Along with notifying the healthcare provider. Those are both correct, but that's not the priority. That's not your first step in terms of your intervention. Providing reassurance that the voices aren't real is not helpful and it's not therapeutic in this case scenario because there's no point in arguing that the voices aren't real with the patient with schizophrenia, right? And again, that's not therapeutic and that's not helpful in this situation. So every time you're doing a mental health, the first thing you should prioritize would be the patient's safety and using therapeutic communication techniques. And that's it for our questions for today. I hope you guys found that helpful. And if you did, please let me know in the comments below. And if you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video.